The pectoralis minor is one of the muscles prone to shortening, and its shortening is often associated with a hunchback posture. The antagonists of the pectoralis minor are the muscles that stabilize the shoulder blade from the back. These muscles are located in this area. These include the small rhomboid, large rhomboid, middle trapezius, lower trapezius, and, to some extent, the latissimus dorsi. The primary antagonists of the pectoralis minor are the muscles responsible for stabilizing the shoulder blade in the front to back direction. The rhomboid muscles, especially in the middle and lower regions, are the most crucial. The pectoralis minor differs from the pectoralis major in its attachment points and starts from the shoulder blade. Here is the humerus, and here is the shoulder blade. The pectoralis minor originates from the coracoid process of the shoulder blade. The second point of attachment for this muscle is the ribs, specifically the third, fourth, and fifth ribs. When the pectoralis minor shortens, these attachment points move closer together. This primarily affects the position of the shoulder blade since the ribs do not move freely. They are fixed to the chest and have a limited range of motion. However, the shoulder blade has a much greater range of movement. When the pectoralis minor shortens, it alters the position of the shoulder blade. The shoulder blade moves forward because the pectoralis minor attaches to the coracoid process of the shoulder blade. But simply stretching the pectoralis minor is ineffective. The muscle does not shorten on its own. A muscle never tenses without a reason. Just as you wouldn't voluntarily tense up for no reason, the same applies to the pectoralis minor. There is always an underlying cause. The pectoralis minor will only remain in a shortened state if its antagonists, the rhomboid muscles, are weakened. When the shoulder blade shifts, the pectoralis minor shortens as a result. Additionally, the pectoralis minor plays an important role in breathing. When the shoulder blade is stabilized in its proper position, the pectoralis minor assists in inhalation. It acts as a breathing muscle. During inhalation, this muscle contracts and lifts the third, fourth, and fifth ribs upward. During exhalation, the muscle relaxes, allowing these ribs to move downward. When it is shortened, these three ribs become restricted in their movement and are excluded from the breathing process. In addition to reduced movement here, these ribs should normally move at the joint between each rib and the vertebra during each breath. This is the joint where the transverse process of the vertebra meets the rib. When the pectoralis minor muscle is shortened, the joints it interacts with cannot function properly. This leads to joint blockages in these areas. As a result, these blockages cause further weakening of the antagonists of the pectoralis minor muscle. These antagonists include the rhomboid and trapezius muscles. The rhomboid muscle, for example, attaches to the transverse processes of the vertebrae through bony structures. Additionally, this weakness can extend to the neck flexor muscles. Many issues, such as vertebral artery syndrome and occipital nerve entrapment, are connected to this group of muscles and the fixation of these joints. If these joint blockages persist for at least a month or longer, full recovery will not occur just by starting exercises for the affected joints in the lumbar region. Without first addressing these blockages, normal movement cannot be restored. For example, consider the rhomboid muscle. If one of the joints between a vertebra and a rib is fixed, that joint cannot move, and the part of the rhomboid muscle attached to it becomes non-functional. When you try to train the muscle, it will grow overall, but not in the affected area. This imbalance within the muscle itself can cause further problems. Sometimes within the same muscle, there are weak fibers alongside shortened fibers. Sometimes, for example, the muscle's antagonist and agonist can coexist within the same muscle, resulting in a combination of weak and shortened fibers. This imbalance underscores the risks of doing exercises without resolving these issues first. Attempting exercises prematurely can lead to worsening conditions. Initially, they might provide relief, but the problem often returns or even intensifies. Another consequence of a shortened pectoralis minor is restricted chest mobility. This can make it feel like the person cannot take a full breath. They want to inhale deeply but cannot, because the chest is already in an inhaled state due to a shortened diaphragm. To achieve proper inhalation, the person first needs to exhale fully. To do this, the shortening of the pectoralis minor muscle must be resolved. Beyond limited chest movement and disrupted breathing, a common symptom of a shortened pectoralis minor is numbness and weakness in the hands. This often first appears at night. Why at night? When sleeping, a person may lie on their arm or on their side, causing the shoulder to shift forward slightly. With the shortened pectoralis minor, additional tension arises, affecting the vascular nerve bundle beneath it. Here is the brachial plexus, which transitions into a group of nerves that pass beneath the clavicle and the pectoralis minor muscle. From there, it extends into the arm, providing innervation to all the arm muscles. When the pectoralis minor shortens, the arm muscles cannot fully develop their strength. Initially, this weakness appears under load or in extreme positions, such as when the arm is stretched out. Over time, it may also occur at rest. One way to stretch the pectoralis minor muscle is as follows. Stand near a corner and place one hand on each wall. Raise your elbows to eye level or slightly higher, and shift your center of gravity forward. You should feel a stretch in the pectoralis minor muscle. You can also perform this exercise in a doorway. Place your hands on the frame and shift your center of gravity forward. If possible, this stretch can also be done against a wall. Place your hand on the wall and turn your body away to feel the stretch. This exercise must be combined with strengthening exercises for the rhomboid muscle and the middle and lower trapezius. Another way to stretch the pectoralis minor muscle is in a doorway. Place your elbows at eye level or slightly higher and shift your center of gravity forward. This will stretch both pectoralis minor muscles and, inevitably, the pectoralis major muscle as well. To isolate one side, place your hand against a wall and turn your body to the opposite side. Common mistakes during these exercises include bending the lower back when shifting your center of gravity forward. This places excessive strain on the spine. Additionally, do not lower your head or position your hand incorrectly. If the elbow is too low, The pectoralis major muscle will stretch more, while the pectoralis minor muscle will hardly stretch at all.